Okay, good morning, everyone. Welcome to the officially Southborough Board of Health meeting this morning, but we're also joined by folks from Northborough and Boylston, as well as the Collins Center. It's 9:32 a.m. and 2 out of 3 board members from Southborough are present, myself and Nancy Sacco. So with that, I'm actually just going to tee up what we're going to talk about today and then do formal introductions. So as you all probably know, Southborough applied for a best practice grant through the state and was awarded $55,000 and has signed a contract with Collins Center in collaboration with Northborough and Boylston to look at potential options for regionalizing public health. Currently, the 3 towns plus Westborough are engaged in a public health excellence grant in which we receive $300,000 a year to provide services to our residents for public health. So we share services like inspections for food and housing, as well as nursing hours, some software, and I'm sure Kristen can go on and on about all the services that we get through that grant. So that's been very successful. So the 3 towns agreed to look at options for regionalizing further. So that's kind of the genesis of why we're here to kick off that discussion. So I'm Chelsea Malinowski. I'm the chair of the Board of Health of Southborough. And Nancy, do you want to go ahead and introduce yourself?
Yes, hi, I'm Nancy Sacco. I'm also a board member on the Southborough Board of Health, just for another couple of weeks.
Yes,
Nice
great.
to meet everybody.
Sarah, do you want to go introduce the Boylston folks?
Sure. Sarah Barrett, Chair Board of Health in Boylston, and joining with me is Anne Marie Muckenstrom, who is our town nurse who has been working with Erin.
Great, thank you. Heather, do you want to introduce yourself?
Good morning. I'm Heather Alger, Health Director, Southborough. And
Taylor?
Hi, I'm Taylor West. I'm the Assistant Health Director and Public Health Nurse in Southborough.
Mark?
Mark Purple, Town Administrator from Southborough, and I do want to acknowledge that we'll be losing Chelsea from the Select Board in another couple of weeks. So or at least she's not going away from public service. She's just shifting direction a little bit.
Thank you. Kristen?
Thanks, Chelsea. So my name is Kristen Black. I'm Health Director in the town of Northborough. And Rebecca Meekins, our Assistant Town Administrator, is in the process of trying to join. She's just watching, so I don't know if she's in limbo land, but thank you.
I got her. Thank you. She should be coming over now. Okay, great. And Morgan, do you want to, so Morgan's from the Collins Center, and I've been working with her on prepping for this meeting. So Morgan, do you want to introduce yourself and your team?
oh, and can I just say thank you to Nancy Sacco after her many years of service on Southborough Board of Health, which is winding down.
Thank you, Heather.
Well, thank you all for hosting this and taking us on for this project. I'm really excited. I've been on the Collins Center. So my name is Morgan Clark. I'm a public service manager at the Collins Center, and I've got a slide that tells you a little bit more about what we do. But I'm really pleased. I run a lot of different practice areas for the Collins Center, but this is my first official public health project. And that's great because I think I'm ready. I ran a health department for 10 years, but I burned out, like I'm sure a lot of people are feeling during the pandemic. So took a little break. I've been doing some economic development and policing and public safety projects, but I'm happy to be back with my people. And I'll have Amy Concannon from my team introduce herself as well.
Hi everyone, I'm Amy Concannon. I've been with the Collins Center for a little over 3 years now, and I'm excited to be on this project with you all.
Great, thank you. So I'm going to hand it over to Morgan. She has some slides that she's going to share with us. And so Morgan, go ahead.
Hold on one second. Okay, is that working? Okay, great.
Yes.
So we're here to launch the project of a public health regional assessment with Southborough, Northborough, and Boylston. Just a few words about what the Collins Center does. The Collins Center is dedicated to improving the efficiency, effectiveness, governance, responsiveness, and accountability of public sector organizations with a particular focus on local and state governments. We do this through a variety of approaches, including technical assistance and consulting. We also do training, education, and professional development. And when we have the time, we try to create some publicly available resources for communities as well to use on their own. This was updated at the end of 2022, but we've added some more on the map. So we've actually filled in some of the gaps. But as you can see, we work, we don't only work in Massachusetts, but this is primarily what we do. And we've worked in a lot of places more than once, and we're happy. I don't think this is our first project in Southborough, so we're also happy to be coming back. So some background, though, Chelsea did give us information. Southborough received this Commonwealth Compact Best Practices Grant, which is to assess challenges posed by the recent public health crisis and identify opportunities for building public health infrastructure and staff capacity, as well as develop shared public health services with contiguous municipalities. So as you know, the Board of Health is interested in exploring how it can regionalize all or some public health operations with Northborough and Boylston, and we're here to help you with that. So how we're going to do that is through document review, and a couple slides further, I'll talk about the documents we're thinking of looking at, but I'd really love to hear from all of you because you know what you have and what we should be looking at. So then after, we'll be conducting interviews. That includes with town administrators in each town, the health department staff, key stakeholders from the boards of health, and any department heads from partner departments where public health work is kind of shared. That could be the Council on Aging, public safety, something like that. I know it's different in every town. And we'll also be talking to the Mass Department of Public Health, especially the Office of Local and Regional Health, right? Because a lot's changing, and we want to make sure that whatever seems to fit best for these three towns is also keeping with what DPH has in their grander schemes for improving local public health across the state. So then we're going to draft the assessment, which will include a presentation of a range of options for regionalization or sharing services with attendant disadvantages and advantages. We'll also include a framework of legal and regulatory considerations to be considered or included in a regionalization or shared services agreement. We'll include a summary of the implications of the Mass Department of Public Health capacity assessment findings on any potential regionalization or shared services opportunity. We will provide budgetary considerations, guidance for maximizing funding opportunities for shared services, and suggested mechanisms for how an arrangement could work, and an implementation roadmap. And the assessment will also include written out all the methods we use, because we know that, you know, you're in this great region where there's a lot of good things going on and different partnerships across different communities. So we want to make sure that you can take whatever we did and apply it if there was another community that wanted to join in later on. I know that that's a question, so we want to make sure that whatever we do is replicable moving forward. We will bring that draft assessment and discuss it with the administrations, the staff, and the boards of health from each partner municipality. I see it as kind of an iterative process here. We want to incorporate your comments and feedback, and then we'll finalize that assessment for your public health regionalization opportunities. Here is a timeline. We're starting a little later than we thought, but that I think should work still. So with the goal being that we give you the final assessment in December. If it turns out that, because with the idea being if there was funding, if you needed to put things in your budget for the next fiscal year, you would have that information. But the way I see it is either way, you'll have the draft, you'll know where this project's going, even if there's some last minute editing or something that pushes us into the new year. So the data that I'm thinking I'll be asking each town for, but again, this is where I'd love to hear from you about things that we haven't really thought about yet, or data that you know that you have. So for each town, we're going to look at how many and what kind of permits and licenses are issued by the health department, and looking at the whole gamut, right? From retail, food service, tobacco, camps, bathing beaches, all of it. We want to see how much of each town is on septic or sewer or cesspools. We want to know where your drinking water is coming from, what your local economy looks like, what kinds of businesses and industries are predominant, and also, you know, if you have local comprehensive plans about what kind of businesses you want to attract, right? That should play a role too. Any environmental or public health indicator data that tells us about the status of public health in your town. Also what the departments are required to do by state and local regulations, how those activities are tracked and measured, any data you have there. And then also a comparison of each of your regulations, your local regulations, and see where there's alignment or misalignment. We'll also look at your existing shared services, how they're structured, how they're working, what kind of data you're collecting for those. So this is a piece that I'd love to hear from the folks on this meeting about if there's other areas of work that we should be looking into and reviewing data on, any hot button topics that we should be aware of going in. I'm gonna pause and just open the floor if that's okay.
I didn't see anything on communicable disease tracking and that work that's being done by all our municipalities. I think you'll also find we work closely with the Northborough, Southborough schools, two of the towns, on public health and substance use prevention.
So for the schools, is that something where you think there's data, or more it's a conversation with another partner department that you're that you partner with?
You could think about talking to them about partnering.
Great. Great. And yes, the communicable diseases was the environmental and public health data that I was referring to in really general terms. So thank you for making that more specific. Anything else?
I think one of the things that, oh, go ahead, Kristen, and then I'll go.
Oh, no, just thanks, Chelsea. One of the thoughts, Morgan, is, you know, public health has changed so much in our region in the last 2 years. And so while it's really helpful to say, what are we doing now? What are our permits now? I think it's really important to separate that in terms of, okay, so we have all these environmental permits or inspectionals, who's doing them now? And also like who did them in the past? I think the fear we all have in regionalizing and relying on state grants is what happens when they go away. And I think it's really important to not just say, hey, look at all the great things you're doing now, like check, we're done, you know, this is how you could get bigger and better. But my goal would be to really have a plan that if we have a plan with the, you know, if those grant funds go away, to really become sustainable within our existing budget. So I would just say as you're pulling that data, it's okay. So in you know, Northborough, we were behind in our food up until the point of these PHE grants. And I think, I don't want to speak for the other towns, but I see some head nodding. And so it's really to say like, what was our compliance? And that's part of what the state did with that BME CART project that we've all heard about. You know, where was our compliance, you know, pre-PHE staffing? Where is it now? And then we can better make a plan for the future with different assumptions, you know, assumptions of 50% grant funding or phasing in sort of regional aspect. Thank you.
That's really helpful. If I can ask a follow-up question, well, maybe it's something that we'll get more into in an interview, but I guess in general, I'm assuming you're saying like you weren't getting the 2 required inspections every year for food service or something. And I'm guessing that like most health departments, it was because you didn't have the time and the staffing. Is that right?
I could speak for Northborough. We had a part-time food inspector who's not in this room or any of these individuals. There was no supervision and he wasn't meeting the job. So in Northborough, I could say some of it was staffing for sure. There wasn't enough, but it's also a management issue.
Okay. Okay. Oh, that's good to know. Okay. Yeah, we'll definitely look into that. And thank you for giving me that background. That's really helpful.
Morgan, would you mind just going back to the slide with all of the information that you had so we can see what you had on it? Thank you.
Sure.
I know Chelsea wanted to say something, so go ahead.
Yeah, I think at a more basic level, Morgan, one of the things that I think municipalities struggle with not just in public health, but anytime that you look to regionalize something, how do you staff hours at the individual town level, right? Like right now, even Southborough, and you'll see this as you dive in, we only have like hours that people can stop in the morning because we share an admin with another department, and she's only there in the morning. So, you know, is there a best practice for staffing, and what, in terms of septic inspections, is there a best practice in terms of the amount, you know, the amount of days that you shouldn't go without inspecting something to be closed up? So I think that's one of my concerns on the Southborough side, is anything that we do for region, how do we mitigate any risks at the local level, and what do the hours look like?
And just to clarify, Morgan, also Southborough is 100% septic.
Great. So when you say hours, it's what I would assume is like your window, or like when people can drop in and request an inspection, and you're saying
Right.
they can only drop in the mornings, and then if you, so Chelsea, you're talking about holes in the ground and how the
Yeah,
operations.
so I think
Okay,
it's
got it.
it's two-part. It's people dropping into the office, and then it's people requesting inspections. And we have a part-timer who's here 2.5 days a week. So if it's a Friday afternoon and the hole's open and ready for inspection, we can't inspect right now until Wednesday.
And again, this might get a little too much in the weeds, but this is so helpful to hear. I'm assuming that you have kind of the same 10, 20 installers, right?
Mhm.
So like theoretically, you could tell folks, we only
Well,
do,
I guess
no.
that depends.
Okay.
We may,
Okay.
yeah, but that's just, I think in general, I think one of the biggest concerns is, what do you lose by regionalizing, and how can we set up a structure so that we're available to provide services when residents need it, and what's an acceptable timeframe?
Yeah. Okay, this is really helpful.
Again, like just getting into the weeds, and I think it probably falls under like bathing beaches, but if you wanted to include pool inspections in there.
Oh yeah, definitely. Do any of the 3 towns have a lot of those semi-public pools that are like in condos? Like, is it a lot, or?
No, we have
Okay.
3 semi-public pools in Southborough. And
Okay.
that's all we have. We don't have beaches or anything like that. So that's great for us. But I'm not sure what the other towns have.
Okay, thank you.
Through the chair, Morgan, so in Northborough, again, our communities, no public beaches, like outdoor lakes or anything like that here in Northborough. We have 5 pools, so pools are a very small proportion of what we do.
Yeah.
Northborough is, we are 20% private well. Rest of, for us, we're MWRA, and we are 70% septic in the town of Northborough. And so I think just to build upon what Chelsea said, like one of our biggest needs is, you spoke about installers, Morgan. There's a lot of installers in this area. I know I think you're coming from the Cape, where there's less as you get further out because the ocean prevents them coming in from the other side. But out here, there's a lot of installers, a lot of overlap. I could pull the numbers, but we've seen in certain years working with 25 different people. So that's one of our biggest challenges.
I think our list is like 2025.
Yeah, so lots of installers. I think from to build off of Chelsea's point with septic, I mean, our goal is that, Northborough, we all have different town hall office hours. Okay, so I believe Boylston's closed on Friday. Northborough is a half day. I mean, our goal for everybody is to have staff available 5 days a week. And for installers, I know it's really important, they're working on tight schedules, they want to close up a hole, safety concerns, so I think as we work through septic inspections, we really want to think about, is there a way we can offer a better offer as a region, like full inspection 5 days a week, where right now, Northborough, we do 5 days a week, but like, if we were to look at a regional model, how can we make sure that everybody has the greatest coverage possible and you have that overlap?
Sure. Thank you. That's really helpful.
And
Anyone?
Yeah, I can chime in for Boylston. We are 100% septic. I don't know the percentage for private wells versus public drinking. But I know I'm on a well, so we definitely still have some wells in town. We did have a beach, but that area got bought, so that's not an issue. And like you had mentioned before, I think the food service and the inspections, it was, not enough staff. So, but that now we're getting help from the greater boroughs, which is really nice. So, and tobacco, we're hoping that we can join a coalition that Kristen had started to help us with. So. I think that's it.
Thank you.
Welcome.
While we're all together, is there any other, the septic thing is loud and clear. I'm wondering if there's any other hot button issues that I should be aware of.
I would just say, like, this is not necessarily a town specific thing, but as far as like nursing services offered, obviously we're looking to eventually expand like just basic foundations of public health to align with the blueprint. So obviously we would love to, from a nursing standpoint, I would love to expand the services that we have and be able to offer. We're able to offer great things through greater boroughs. But obviously there are so many things, especially like through the scope and standards of practice through public health nursing, that we're just not meeting. They're not requirements in Massachusetts, but it would be great to like pave the way and say like, we're able to provide all of these services and here's why they're beneficial. But that's like a long-term goal that we're also just looking at like at a state level right now through like our Public Health Nurse Association. So that's like a side project for me, but it's something that I'm really passionate about.
That's so great. And I know that during our interview, you'll probably give me more information, but just so I have like an idea, can you give me an example?
So like the scopes of standards and practice, like one thing that like some other states are doing that we're not doing, and again, it may not be specific and it's definitely a long-term goal, and it may not be a huge need in this area, but maternity and child home visits are a big part of what public health nurses are able to do. Just following up with people after they have their baby, make sure like their screenings are and they don't have any concerns, save them from hospital visits and overloading the hospitals. I'm happy to send you more information, but that's something that like we're not meeting.
Oh, that's interesting. So our town, we contracted with the local VNA, and so they did provide that service. And you're saying that in Southborough, it's not existent.
It's not in most towns in Massachusetts.
Okay.
And Morgan, something else to consider, as you know, in public health, there's emergency preparedness. I know we're in different groups. I don't think that's too much of an issue, but we're broken down for example, Metro West Health Foundation, Northborough and Southborough are in the area that are covered by that. They provide a lot of information and grants to Northborough and Southborough. If we say we're a 3-town quote region, I don't know if Metro West would rule us in or out for grants or something like that, but we do, I think geographically, we're sort of in that Metro West, Central Mass. We, like I said, for a couple things, we fall into different regions.
That's a really good point,
Public
Heather.
health.
Also, for our, FEP region or
Emergency,
region
right.
for emergency preparedness, Southborough is in a different region than Northborough and Boylston. And myself and Kristen are very heavily involved in emergency management. And we can't collaborate at all really with things that we do because our regions are entirely separate. So
Can you tell me, is it the HMCC regions or the MEMA regions or both?
Yeah, it's the HMCC regions.
Okay. I wonder, I've never been a part of having a conversation with MEMA about changing them, but I would hope that
It's not
MEMA and
MEMA.
DPH.
Yeah, it's not MEMA.
Oh, right, the DPH,
It's that-
okay.
It's
yeah.
the DPH regions, yeah.
Right, we're for
Okay.
AB.
And personally, I would love to stay in the region that we are in and see everyone move over. I don't know how
Yeah.
other people feel about that, but we're fortunate enough to be part of a really great region that is also connected to Boston. We're kind of like the last town in that region. So,
Okay, that's good to
For
know.
AB. Mhm.
and Kristen and I have had conversations about this in the past.
It's really interesting, right? Because that's like a different line of DPH, a different wing of DPH, and it's like we're doing this work over here to work with local and regional health, and yeah, okay, great.
Morgan, we're also, two of us are elected and one's appointed. So understanding the differences between whether you're elected and appointed and the control that you have. So I think that could play in here, and just making sure that whatever we choose to do, we continue to maintain our individual boards. I think that's just important to understand, and if we need to adapt, that we do that.
And how many of the towns have charters or not?
Southborough does not.
No, for Boylston, I see. Okay, Kristen, does Northborough have a charter?
We have our bylaws, I think with the charter, yeah, so we are we are appointed in town, so all of our Board of Health staff are employees managed through the town managers, administrators. Becca, get me on the charter thing, can you? Yeah, just Northborough.
Northborough has a charter. The Board of Health is appointed by the town administrator. All staff are appointed by the town administrator. So I think it's a maybe stronger town administrator, just with respect to the setup of the boards and the staffing. So it's just a different model.
Great, it'll be interesting. We'll look into all of it. But yes, the actual implementation of regionalization should be interesting across the board. Anything else, folks? Well, you'll have plenty of time. Oh, go ahead, Kristen.
No, so just real quick, so we will have sort of pending, we have a drug-free community application, which is Northborough, Southborough will know in July or August. And that would be a full-time position, it would be working closely with the schools. And hopefully that individual will be supporting the schools or in the towns with opioid use settlement funds, and really planning around that. I think in Northborough, one thing that's unique, we have contracted our nursing always with Salmon VNA. So you mentioned a similar situation before with certain services. So we do have a very interesting model. You'll learn about that. And the town of Northborough is currently contracting with our shared nursing staff, but there was some direction from DPH that, long-term that would not be allowed, and we'd be moving to full-time employees. So we even internally have some review we'll need to do, classifications and at the direction of DPH for these grants. And I think, your point along those VNAs, they can have valuable services, or currently Northborough, we have an individual on board that just helps us with plan review in the office on an hourly, part-time employee basis. So anyway, so many models, we've been solving things differently, but just realize, I think in asking the questions, there may even have been a model or a contract or something that worked 2 years ago. So there's so many ways to solve this puzzle. I think it's really important to put everything out on the table and see what's working. And I think what we find in public health, and to Taylor's point about emergency preparedness, is, we've had so much turnover in health departments, and I hope everything that we're doing here is obviously through the blueprint lens of building capacity, training, and really employee retention. I previously worked for the town of Uxbridge, which was an elected board, and I was really at the whim of the Board of Health, which was always very good to me over there, the Board of Health, but it's not always a stable work environment when you're not, within the channel. You're up to a board to hire or fire you. And I think like Heather's position may be within that realm. I don't want to speak through, but it just really, everybody sort of has a different structure and reporting. And I think it's really important that we understand sort of how to build stability for all of our employees if they're within the shared service region.
Great. That's really helpful. and-
Morgan, sorry to interrupt. One more thing that is important for you to know probably is that Northborough is currently searching for its next town administrator. So I know the folks from Southborough and Boylston know that, but just so you know, we're in the middle of a search, and I don't expect to have somebody in the position until probably late summer. So just so you're aware of that as we move through this process.
Thank you, Becca. Are you the acting?
We have a part-time interim, but I'll stay involved in the process up until we get somebody.
Great. Thank you for letting me know. And Kristen, some of your comments made me realize that we will ask about grants, existing and pending. And
Right, I
that's-
mentioned that Metro West, right, Health Foundation, but yes, I was gonna mention that to look at grants.
Great, great. Well, that was really helpful. The really last slide that I wanted to go over with you is that it'd be really helpful to have an advisory committee or team to advise the process, review preliminary findings, someone from me and my team to, not someone, a group of people that we can go to and say, like, this is the direction we're going, or what do you think about this? So I'm imagining one representative from each partner community. It wouldn't be a super heavy lift, probably meet monthly, maybe more frequently towards the end of the project. And ideally, I'd love to determine that membership by next Friday so that we can really hit the ground running and get moving on this. So you don't have to decide right now, but it would be great for, and I guess maybe coordinate through Chelsea. Would that work, Chelsea?
Sure. Yeah,
Okay.
that works.
So that's all that I have. This is my contact information. And I, want to make sure that any questions you have, that I answer them. But I know that this is the beginning of a project and know that I'm here and available at any point. And I obviously will be reaching out to each of you individually as the project moves on to interview you as well. But any questions at this point?
I think, Morgan, in terms of next steps with getting documents to you for each town, are you going to be sending out a document request list? And then
Yes.
how are we going to, I think every town will probably have different stakeholders that they want you to interview. So how should we coordinate that? Would that be through the representative on the advisory team?
That's such a great question. So let me answer the first about the document request. Yes, we're going to put everything in writing, though I guess I should know who to send it to, because there's this mix of staff and volunteers. So maybe Chelsea, if you could get some clarity on,
Okay.
this is the staff contact, I would imagine, for each town. That would probably
Okay.
be the best person for a document request.
Okay.
And then as far as, what was the second part of your question?
On the list of who every town wants you to
stakeholders.
interview. Mhm.
Yes, that should probably be communicated through your representative on the advisory team. But
Okay,
that, if I go back to the work plan, ideally the document review, a lot of that's happening before we start doing the interviews. So we'll know what kind of questions we want to ask. So we don't need that list right now. Not that I think it's going to change all that much in the next month or so on URL's end, but just know that, like, my team needs to get more familiar with your landscape with the documents and stuff before we can even start asking questions or knowing what questions to ask. But yeah, keep that in mind. And I would say that as soon as we know who the advisory team is, then they'll be the ones. But I'm happy also. I love working in groups. I love floating things by groups, but I know that, like, some of this we need to be careful of open meeting. So that's why we're looking for the advisory team. But if any point you're like, this should just go out to, like, the group of people that are on this call or something, I'm happy to, like, arrange a meeting or do some emails or calls or whatever it is. But yeah, I think that would be a critical role for the advisory team members to say, well, this is who you have to talk to in our community. Does that help?
Yes, thank you.
Great. I'm going to stop sharing my screen because I can only see some of you. Okay. Well, that's all I have for how this project is going to, or how we think it's going to work. Any project, things happen. But like I said, I'm really collaborative. Especially with all the different elements and variables that you all just introduced, that I hadn't thought about before. I'm really visual, so I'll probably start making like charts and stuff, and I'm happy to share those as we go along and just get everyone's read. And like I said, we'll be interviewing you one-on-one and really getting to know your perspective and everything that you want us to consider as we move along.
Great. Thank you. Does anybody else have any final comments for Morgan? No. Okay, well, I appreciate you all joining this morning. I think this was productive, and I'm excited to start working with you all on this. So if Kristen and Sarah, you can get back to me by next Friday on who you want your rep to be for the advisory team, that would be great. And I can get that over to Morgan. All right. So I'm actually going to have to adjourn the meeting. So I move that we adjourn the Southborough Board of Health meeting at 10:08 a.m. You're on mute, Nancy.
I second the motion and vote aye, Sacco.
All right, Malinowski, aye. Thank you very much, everyone. Have a great weekend, even though it's going to
Thank you
be
all.
awful.
Thanks, everybody.
Thank you.